I'm on ACA plan in Alabama, single 33-year-old male. My premium is increasing from $100 to $713. Millions of us are about to be uninsured. Yeah. And there's also so many additional consequences of this. Because if a guy like you, a 33-year-old single male, who is less likely to be sick and less likely to actually tap in to the overall insurance pool, then you're just going to not take the chance. You're going to be like, all right, I'm just not going to have health insurance. Like, I'm relatively healthy. So when you're taken out of the insurance pool, insurance providers lose their leverage, right? Because that's how insurance works. For those of you who don't understand how insurance works, insurance providers will take a large pool of funds and will basically leverage the healthier population that has bought in to the insurance that never ends up using said insurance against those who are less healthy, who have a higher likelihood of using the insurance. This is how you create an insurance pool, right? But when the healthier people are like, well, I'm young, I'm healthy, there is a lower likelihood that I will get sick, so I'm just not going to pay these insane premiums, they pull out. They pull themselves out of the insurance market, the insurance pool, making it even more costly, because then you remain with only people who are the most sick, who desperately need insurance. Therefore, it creates this weird death spiral, right? And that is the major problem with the ACA subsidies. It is obviously a horrible public-private partnership structure that we have designed, not dissimilar to college campuses, not dissimilar to universities and how much their costs have also ballooned over the years. So when Republicans actually look at this structure and say, this system is broken, they're not wrong. It's just that they want to break it further in the wrong direction, in the direction of deregulating the marketplace further, allowing insurance companies to basically offer you junk insurance programs, which kind of already happen, and also maybe even deny coverage to people with pre-existing conditions, because those are the ways that insurance companies can basically eradicate the more costly elements, the more costly patients. Okay? So that's the system that we have. And that's the issue that we have. They want to continue privatizing insurance even further and make it even worse and more costly. Whereas those of us on the left want to make this one singular pool, single payer healthcare, socialized healthcare, universal healthcare. This is what we want to do. Because we understand that it is far cheaper overall to have one major pool that is comprehensive and covers every single American. Okay? That way, there is no additional market competition amongst insurance providers. There is no bloated, unimaginably costly middleman that doesn't need to exist. It's the best solution. It's cheaper. It's good policy. It's good politics. People want it. And yet, there is consensus, at least in Washington, amongst all the politicians, regardless of their party, regardless of their ideological background, with like some very few exceptions, that insurance as a sector must exist. There has to be a private insurance industry. Very, very dumb. And also incredibly consequential, incredibly bad. And yet, this cruel system still remains. But, as it stands, despite my advocacy for Medicare for all, I still recognize that the Democrats are doing the right thing to, at the very least, offer an immediate Band-Aid solution by pushing the government to continue funding ACA subsidies so that people just don't have a lapse in their coverage, or people don't see a massive increase in their premiums. Because like open enrollment starts, and if you actually just auto sign off on your pre-existing healthcare, you might be paying like 3x without even realizing it on your premiums. You have to, in a country where 64% of Americans are living paycheck to paycheck, okay, and can't pay for $400 in emergency funds, that's the first premium payment that you have to pay that will directly put you into potentially bankruptcy. It's ridiculous. It is fucking ridiculous. It is unimaginably cruel. It is ridiculous. And the Republicans don't even want that. They don't even want the Band-Aid. It's crazy. Democrats and Republicans have put a Band-Aid on a gaping wound, and the Republicans ripped the Band-Aid off. And they're like, nah, let the wound get worse.
And everything snaps back into shape.
Democrats demanding Republicans work with them to extend Obamacare subsidies, but Trump and Republicans say they won't negotiate until the government is reopened. The impact snowballing. Air traffic controllers.
My family is truly and genuinely fucked. We simply cannot afford new monthly premiums for health insurance. It went up like 45%. Like, no joke. It's going to be $1,300 a month starting in January. I have less than 2 weeks to decide if we go without insurance or without food or other necessities. I just don't think this can continue. There is no way. There is no way that this can continue, okay? It just doesn't. Maybe I'm wrong, but this level of instability, this level of inequality, this level of unreasonable pain that the working class are subjected to, it can't continue happening.